The reason I feel parents should take their children to see a social worker when they have concerns about their behavioral health is because they may be acting out at school, they may be acting out at home, and one of the first things I like to do is have them go in for a complete physical, and then when there is nothing physical going on, sometimes I will refer to a psychiatrist or to a certified play therapist. I also will work with parents on developing routine, consistency, and stability, because I have found working with families over the years that those are the three things that are lacking a lot of times in a family. All of this can reveal what is really going on to also address any emotional, physical, or any sexual abuse, even if it's not in the family unit.
What type of treatment do you administer to adolescents? What modality do you normally use?
Well, I'm a behaviorist. Early on, I had opportunity to look at some operating conditioning, and I know we don't do a lot of that now, but Skinnerian principles. And I just kind of believe that, still they kind of teach it differently, but the way I was taught, it was situation, act, consequences. And I'm still looking at a lot of these kids are situational in terms of they behave based on the setting that they're in, and there must be some consequences that will either decrease or increase the probability of they're repeating those. So I give everybody that comes here, adults, children, homework. I know that the theories are merging together. We're doing therapeutic integration now, and I realize that we're merging, and some theories we're giving homework. But even when I do marriage counseling, I start out with communication skills. That's a handout. I give them an assignment to go home, and they need to watch that for a week.
Office, I use cognitive behavioral therapy, focusing on the thought model, asking the client to identify their thoughts, their moods, their behaviors, and how they physically feel. What's worked, what's not worked. When utilizing experiential therapy is out of the office, and as a therapist, I became certified in the Equine Assisted Growth and Learning Association, which is working with horses. Clients have their own experience with an animal, sometimes working individually, sometimes in a group. How powerful when someone who feels that they have no power moves a 1,200-pound animal with their energy.
Okay, Janine, go ahead.
Okay. So, Dr. Williams, why should parents bring their children to see social workers for behavioral or family issues?
I think social workers are uniquely qualified to do. When we look at the history of mental health, the model is usually a medical model, but social workers are uniquely qualified to not only look at the individual from a holistic perspective, but we also look at aspects of culture and their interaction with their social and cultural environment. That, in contrast to the medical model, is more accurate in terms in determining factors that influence behavior. And of course, social workers do a thorough assessment, and they not only look at one aspect of the individual, they look at multiple factors, a client-centered, client-focused perspective. And social workers are uniquely qualified. That's what we do, and I think that's why it's very effective in terms of mediating behaviors, problem behaviors, and children.
Thank you, Dr. Williams. I appreciate your input. Paula, please tell me, why do you think that parents should take their children to see social workers if there's family issues or behavioral issues?
I'm glad you asked. I've been thinking a lot about this for a long time, and I have come to the conclusion that for most children, Good enough parenting is good enough. But sometimes, for various reasons, sometimes, something traumatic has happened, or sometimes it's biochemical, sometimes, it's an adjustment kind of issue. We don't really always know, right? Certainly parents don't always know. And good enough parenting is good enough for most kids. For some kids, it's not. Some parents are good at figuring out extra things that their kids need. I call it becoming a super parent. Some parents are good at figuring out how to be super parents themselves. Sometimes, through no fault of their own, some parents need help to become super parents. And that's what I think of mental health professionals being there to help with. To help those parents whose kids need better than good enough parenting to become super parents, so they can meet that kid's need where they are.
Well, thank you, Ms. Paul. I really appreciate this.
My pleasure.
Everyone needs help now and then. Trust social workers for your family.
When the night has come and the land is dark and the moon is the only light we'll see, no, I won't be afraid. Oh, I won't be afraid. Just as long as you stand by me. And darling, darling, stand by me. Oh, stand